In robotic surgery, what we make is we evaluate the biomechanics of patient during the surgery. It is a customized surgery for the patient. I am a little bit an obsessive surgeon, so I want to follow my patient for a while. The best thing is to stay one more week.
What makes robotic joint surgery better? Hear from our joint specialist, Dr. Gokay from Istanbul.
We know that every joint has its own biomechanics. So in robotic surgery, what we make is we evaluate the biomechanics of patient during the surgery. Before replacing the implant, before cutting the bone surface, before preparing the bone surface, I am sure that this implant will work in the best way for that patient. This is the most important thing. So in some patients, I put the implant in that position, in some patient in that position. It is a customized surgery for the patient. The most important thing to avoid implant failure is the position of the implant. During the movement, it should make a very stable movement in especially young patients. If we think to put a total knee implant, during flexion, there shouldn't be any laxity like that. It should be stable during all the movement. So what we perform during robotic surgery is to be sure the stability of the joint in all the movement range of motion area. Before replacing the implant, before cutting the bone surface, in the robotic surgery, we are sure that it will be the best implant coverage in that knee for that patient, a customized surgery. So the second important thing is we use a robotic arm because we make a plan in the digital planning, in the computer. We have a robotic arm which help us to have these bone cuts with a nearly 0.1 millimeter sensitivity. It also protects some ligaments and also some other tissues other than bone. So during this robotic surgery, we use small incisions because we don't have to see all over the joints. The system has the eyes and show us and guides us. With a small incision, with a less bleeding, we can replace the patient's knee with a customized implant. It will increase the life, the survival of the patient's implant, and also we will have a stabilized knee. The patient will not feel any looseness or any tightness during any movement. We will have a huge range of motion because we are making a planned surgery. In the robotic hip surgery, you should understand that I can evaluate the movements before I replace the joint in the digital way. Before the surgery, I see how can it flex, how can it uptake. So I am sure that it is the best position of the implant because I can change everything during implantation. I can change the rotation, length. Also, there are different head options. And also, I can change the position of the clamp. 5 degrees anteversion, 5 degrees retroversion. It all depends according to the patient's evaluation before the surgery. Our patients should understand that arthroplasty is a surgery which should be performed once and the best. And robotic is the best nowadays. There is no discussion on it. Nobody can discuss about it. Okay, this is the best way. When a patient comes for a robotic surgery, first of all, we take a CT scan. We are working with a US company and all the scans are sent to the US immediately, and in maximally 24 hours, they sent us a plan, a render of the joint, three-dimensional digital render. So we make all the plans over that renders. 1 day or 2 days later, it depends on also the systemic disorders of the patient. We get the patient to the surgery. After the first day of the surgery, we stand up the patient and we make them walk inside the room. Some patients can get outside the room also, but most of the patients stay in the room and 4 or 5 times in the first day. In the second day, walking in the corridors of the hospital starts, and discharge will be on the third day after the surgery. Patients will walk on their joints with full force full weight bearing, and we'll use a crutch, a walker or a helper during movements. And in a foreign patients, I start rehabilitation very fast.
Okay.
In the 4th or 5th day of surgery, if possible, I advise them to stay for a week here. And so I will take in my clinics with my physiotherapist will work for them 2 or 3 sessions, and after that they could easily go their countries after the first week of the operation. I am a little bit an obsessive surgeon, so I want to follow my patient for a while. Yeah, the best thing is to stay 1 more week. I want to watch them for a while, and 10 days is very nice time interval for hip or knee surgery.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.